My name is Carrie Newlands and I'm a consultant oral and maxillofacial surgeon at the Royal Surrey County Hospital in Guildford. It's a good idea if you think your wisdom teeth are giving you problems to talk to your dentist to see whether you need to have them removed and also if you need to be referred to hospital to have that done. The wisdom teeth are the last teeth to come through, and as such they often get stuck because the jaw runs out of room, and if they do get stuck then they become difficult to clean, and sometimes that can lead to problems with infection around the gum or decay in the teeth, and those are the two most common reasons why people end up having their wisdom teeth taken out. If I were a patient, I would want to know how many wisdom teeth do I need to have removed, do I need to have them taken out under local or general anaesthetic, and whereabouts would I need to have that done if I needed to have it done. I'd also want to know what risks there were associated with the operation for me, and I would also like to talk to somebody about whether I would need to have some time off work afterwards. There are lots of horror stories about wisdom teeth being removed, and when people know that they're going to have their wisdom teeth out, then they'll be told lots of things about how awful it's going to be. Some wisdom teeth are quite straightforward and can be taken out at the dentist's, but other people with wisdom teeth need to go to see a specialist surgeon at the hospital, and in this country most wisdom teeth are removed by oral and maxillofacial surgeons in hospital units. If you're having your wisdom teeth removed under local anaesthetic, then it shouldn't be painful at all. So a local anaesthetic is where there's an injection into the gum to make the area go numb, but you will feel some noise from the drilling, and you will also feel pressure as the wisdom tooth is taken out. If you're having your wisdom teeth out under general anaesthetic, that will need to be done at hospital, and you can usually have that done on a day case basis, so you go in the morning or the afternoon and then go home later the same day. If a wisdom tooth isn't terribly stuck, then sometimes it can be taken out quite simply. If the gum is sitting partly over the tooth and the tooth is stuck underneath some bone, then we usually need to fold the gum back on the tooth and then sometimes drill some bone away around the tooth. More difficult wisdom teeth have to be divided with a drill and cut into smaller pieces in order to make the removal easier, and then the gum is stitched back with some dissolving stitches. There are some risks associated with having wisdom teeth out. It's usual for your mouth to be sore for up to a week afterwards, and it's quite common for there to be some swelling, particularly around the cheeks, and sometimes some bruising. There'll be some stiffness of the jaw, so it'll be a little bit difficult to open your mouth for a while, but that normally comes back to normal within a week or so. One of the important risks associated with having wisdom teeth taken out relates to a couple of nerves which run in and near the jawbone, which supply the feeling but not the movement to the lower lip and chin, and also one which goes to the tongue. These nerves can sometimes get bumped or bruised when a wisdom tooth is removed, and that can result in a feeling of numbness or tingling in the lower lip, chin or tongue afterwards. That's quite uncommon, and if it does happen, it usually comes back to normal, but in rare cases it can be permanent. So that's something that's really important to talk to your surgeon about as to what the risks might be in your own particular case. Afterwards, it's important to take it easy, be aware that you might need to recover for up to a week or so, and if necessary, take some time off work. It's a good idea to keep your mouth clean, so do use a toothbrush. You're likely to have some dissolving stitches inside your mouth, so you'll need to brush carefully around those, but it is important to keep the area clean.